Dental Fuel, the podcast that focuses on what no one else is talking about. Mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. In today's episode, we have Dr. Pamela Maragliano-Muniz. In our first episode, Pamela talks about a clinical mistake she made and how she overcame it. Welcome to Dental Fuel. Pamela Maragliano-Muniz, welcome today, and how's your day going today?
Thank you so much. I'm so happy to be here with you, and my day has been crazy, but this is so nice to kind of sit back and have a chat with you.
Well, I'm so excited to welcome you to Dental Fuel. I'm obviously a big fan, as I'm sure many of our listeners are. You are an amazing clinician. You do amazing things for the profession. And obviously, as a female leader in the industry, I'm fangirling over here at the opportunity for us to connect today. So thank you for taking time out of your day to connect with me and with our listeners.
I'm thrilled to do it. So thank you so much. And the fangirl is mutual. I love you guys at Ignite. So this is awesome.
Very cool. Pamela, please tell myself and our listeners a little bit about yourself.
Sure. So I'm Pam Maragliano-Muniz. I am a board-certified prosthodontist, and I have a practice in Salem, Massachusetts. And I segued into dentistry kind of randomly. My dad thought being a dental hygienist was a good job for a woman. And so he pushed my sister and I to get into dental hygiene. And so I did. Kind of cut a deal with him. I kind of at the time wanted to be a professional hockey player, or I don't even know what I wanted to do, maybe a veterinarian or something. And I said, if I don't get into dental hygiene school, I'll become a veterinary technician, and that can be my don't rely on a man job. And I got right into dental hygiene school, and it was life-changing. I actually loved it pretty much right off the bat. And going into it, not intending on becoming a dental hygienist, I went into it. I loved it, but that's kind of what, when I thought, I said, I'm just going to do more, than my initial associates in hygiene. I didn't really know what that was. So I thought I was going to get my bachelor's degree in research. And I did get my bachelor's degree in dental hygiene. But then when I started practicing as a hygienist, I became interested in what the dentist was doing. So I was working for a prosthodontist at the time, and so I wanted to be like them. So I went to dental school, then pros, and here we are.
How long did you practice as a hygienist?
Not very long. I practiced for 1 year full time. It was sort of a little too late for me to apply to dental school right away, and I needed organic chemistry 1 and 2. So I took those over the summer, worked full time for the year, and then applied to dental school. But I always loved hygiene and I always loved prevention. And so we started implementing CAMBRA, caries management, into our private practice once I graduated pros and started working again. And we won the Adult Preventive Practice of the Year from the ADA. And that was super cool. We really just did it because we wanted a plaque on the wall. And that's not really what happened. It was sort of like, well, now tell your story. Would you give a webinar? Would you give a lecture? And I was like, okay, I'll ride this lecture wave for a year or two, figuring, I'll get my message out there and then I can just go back to my normal life. But then one thing led to another, and I'm an editor and a lecturer and doing all the things now, but at the heart of it is I just kind of love dentistry.
That's excellent. I think that the love of dentistry for many of us kind of allows us to kind of grow the passion into the profession beyond just the clinical scope. As a prosthodontist, what would you say your day in and out are for you practicing?
Gosh, that's changed so much over the years. So I run a restorative dental practice. So I don't pretend like my practice is limited to prosthodontics, because it's not. I have 4 hygienists that rotate throughout my practice throughout the week. And so there's some patients where I'm their dentist. So if they need a tiny restoration or nothing, or simple clear aligner therapy or something like that, I'm here for that. And then there's patients that are referred to me by other dentists or patients of mine that need more comprehensive care. And I'm here for that too. And back when I first became a prosthodontist, I was like, more is more. And now I would say I'm probably more conservative with my dentistry now than I was before, where I feel like I'm old enough to kind of know what's going to last. Mm-hmm. but young enough to know that I'll be seeing my dentistry again. Things will fail over time. And, the more tooth structure you have to work with, the better off that tooth will be. So I feel like, my day in and day out is I'm a restorative dentist. So whether it's, I'd say probably prep, I'm looking at my schedule, at least a crown, during the day, but I do a lot of composites, and then I do a little Botox and a little clear aligner therapy and, whatever.
Great comprehensive practice. I feel like that's where I'm at now as a still new dentist. I'm only a few years out, about 5 or so. And I have a conversation with my assistants from time to time and saying, especially when I have exams that come in and some questionable dentistry comes in, and it's been around and it's lasted and it's doing okay for 30 years. And I take pride in the work that I provide to my patients. And I go, I really hope that I'm not starting to see my work in 10 years. And I hope that it'll last 30 years. But teeth are interesting. Teeth kind of do their own thing. And one can only hope and pray that following the principles that are set upon us, that things will last in our work. Pamela, I would love to talk a little bit more about the location of your practice. I hear that it's in Salem, and with Halloween coming up, I would love to know if you all do anything special, and I would love to know what your community does during Halloween.
Oh my gosh. So I feel like there's 2 schools of thought in Salem. Yes. So it's like all about Halloween. And in fact, if you come visit Salem, you could wear your best costume any time of the year and nobody will think you're weird. So it's just a quirky town. And patients ask about it even to this day. And I'm like, you know what? If you hate Halloween, you shouldn't be in Salem, basically.
Yeah, I bet. Yeah.
I find that people either embrace it and they love it so much, or they head for the hills. And so so it's getting busier, even like in the summertime, it gets busier and busier. October is kind of insane as far as having tourists come in here. So we kind of just sort of let the year dictate what happens. So I've tried to change my hours and work like 7 to 3 and get out, but then inevitably we're here till 5. So we're kind of here to do whatever we need to do while we're here, knowing that October is just never a great month.
Yeah.
And, what we do kind of changes. So last year, so they do a kickoff in Salem. The first Thursday of the month is called Haunted Happenings, and they have parades and, like all these things. So we decided to do Halloween manicures. So we stayed in the office, got pizza, some champagne, and we did our nails. And then, I don't know, I got up and I walked to the front of the office and I was like, oh my gosh, imagine I don't know, Mardi Gras swarms of people outside my office. And we got stuck here. We couldn't leave because we couldn't drive. The road was closed. So we were stuck in the office till 9 p.m. So now that day we're going to close at 12 so we can go home. And we're actually decorating the office next week. So we'll be all decked out for Halloween. So I embrace it. But to be honest with you, there's so many people here. And when it involves roads being closed and that kind of thing, we just aren't open. So the office is closed on Halloween this year. It's on a Tuesday. So we're closed Monday and Tuesday. I'm actually going to Florida because I go to Universal Studios to Halloween Horror Nights.
Have fun. Yeah.
So I get to do my Halloween away from Salem. But, what's nice is you could be here and do all the Halloween things any time of the year. So I prefer it when there's not a huge line of people in front of me, but it's kind of just cool energy, throughout the whole September, October. It dies down November 1st, it's over, but it's cool energy and I enjoy it.
That's so cool. And for our listeners, we're currently recording this in August with the hopes of releasing this closer to Halloween. So that'll kind of give you a scale as to what Pamela is saying as far as decorating. So decorating in August for October festivities. So probably, like you mentioned, not a great time for the office, but what a great time for the city and the community. I think that's probably a blast, but I can only imagine how crazy and hectic it can get.
It can, but Salem's a city like many others. I actually have even now, it's the middle of August. I have a skeleton sitting in one of my waiting room chairs. So we're already starting the process. But, we've got patients that walk here. So, I mean, if you really need to come in, they'll make it happen. But if our patients, many of them in the middle of September, they're like, I'll see you in November. And then there's some that don't mind it. So, we manage to keep busy. We've tried so many different things. Like we tried to do tooth gems one year. We were like, if you can't beat them, join them. Let's do tooth gems. And we now place gems on people. But, it's amazing. The practice just still manages to go. If we were closed for 3 months for COVID, I can handle a little Halloween. It's nothing.
That's right. Spooky season won't put y'all out of business for sure.
Not at all.
Well, Pamela, here at Dental Fuel, we are dedicated to learning about our guests' mistakes and growing from those mistakes as a community. So my first question to you is, I would love to know about a clinical mistake you have made in your practice and how you recovered from that mistake and the lessons you learned.
Gosh, clinical mistakes. I mean, I would say clinical mistakes to some extent happen all the time. Mm-hmm. And so while we strive for perfection, hindsight's always 20/20. So I would say probably the most common clinical mistake that I encounter, at least in my practice, is diagnosis sometimes. You see a patient for a hygiene check and they had radiographs taken and you kind of blow through them. And, or if you accept radiographs that aren't 100% diagnostic, say they're a little overlapped or say the second molar's cut off and you just sort of accept it. And you don't want your hygienist to have to retake it or embarrass them in front of the patient or whatever. And you just sort of accept it. There could be something that you miss. And so I don't think anybody who practices would be able to say, well, I've never missed anything, because it's not true. But it does happen periodically where something will come up and I'm like, shoot, that was actually on an x-ray a year ago. And I wish, this didn't happen so I could have seen it. So I would say that's probably the most common thing. And, a way to remedy that is to just always have a commitment to excellence. Figure out, whether it's a conversation you have ahead of time. I have this conversation all the time with my team. If there's a question on a radiograph, meaning if it's a little overlapped or it's just not that great, you don't have to even wait for me to ask it. Just take it again, because I want a quality radiograph. So if I miss it because I missed it, then shame on me. But if I missed it because I accepted a crappy radiograph, then, shame on my whole team and all of us.
Absolutely.
And so we can do better. And so I tell them, I don't care if you have to take it again. I don't care if you have to tell the patient, oh, I want it at a different angle, or I want to do something else, or I know she's going to want, this. Just do it, because it's important that we are given all of the information, and, what we do with it's another story, but, quality is really everything.
I completely agree with that. I usually tell my team that if they have to ask, they probably should just do it. Usually if there's a question behind whether or not they should redo something, it usually likely has to be redone, especially when it comes to x-rays. For yourself, how do you kind of manage clinical failures? How do you have any kind of mottos or anything that helps you kind of get through maybe something that doesn't go right clinically for yourself?
We're all human, so you have to own it, and I guess it's depending on why something fails. Did it fail because you didn't follow the instructions for use of the material? Did it fail because you didn't isolate, or you didn't, you kind of were trying to be really fast, or maybe you don't do quality control on your curing light or something like that. So, when things like that happen, and things happen, you just own it. And so I know I've, in this calendar year, I've redone 2 crowns. And basically they were crowns that were like, okay-ish if you didn't take an x-ray. They were fine clinically, but you take an x-ray and I was like, that margin, it's one of those I'm going to always think about or always look at. And, it's going to make me feel better if I replace it. I remember my hygienist was laughing at me because she took bite wings on, and I take pre-seat and post-seat radiographs on all crown preps, on all crown deliveries. So sometimes they look good right then and there, but then all of a sudden a different angle, they might look a little different. So I saw a crown margin that I wasn't in love with. It just looked like a little short. And so I just said to the patient, I'm like, this crown just doesn't spark joy for me. And I would really like to replace it for you. I was like, it's not an emergency. We can do it whenever it works for you. But I would feel better if I had a crown that sealed this tooth better. And they are grateful for it. So it's one thing to get ahead of mistakes. I mean, because again, nobody's perfect. It's when surprises come up and, all of a sudden, that can be kind of awkward. But I feel like if you're ethical about what you see and what you do, and if there's something that you can do better, do better. Obviously things come up, implants fail and, things are unfortunate. Patient, you do a little composite on a incisal edge of a central incisor, set expectations, because when it breaks off, patients need to know that it's not you, it's the situation or their bite or something else. I just say own it, and that's hard, I think, as a young dentist. And I think it's hard as an associate. But now that I've owned my practice for 9 years, I just crossed my 9-year anniversary in my practice. I feel like I am who I am, and I am honest, and I want to see radiographs and be proud of what I see. I want to see things clinically and see my work last. And if it doesn't go the way I want it to go, then let's try again. And we work together to do that.
Well, congratulations to you on 9 years. How exciting. And I completely agree with you. I think that if you treat your patients right and do well by them, do good by them, treat them ethically and your dentistry ethically, I think that the rest will follow. And perhaps that's the secret to being in practice for many years.
I think so. And to be honest with you, it's one of those things that I know I was looking for an associate. And one of the associates I was talking with was so concerned about being sued. And all of these conversations came up about being sued and this and that. And I was like, look, I'm just going to be completely honest with you. I don't even think about it. Like, I don't practice just so I don't get sued. I would say, I would imagine, I hope, I'm going to knock on some wood right now, but I feel like I hope my standards are higher than, what would just keep me out of a lawsuit. So I feel, and it's just not something I even think about. And I know my patients and they know me. And I know there's so much pressure to produce, because right now, especially for new dentists, the loans are outrageous and the interest rates are even more outrageous. And you have to be able to meet those goals. But if you just do the right thing, you'll be able to enjoy your practice, enjoy the people you're with, do the work that you know that you can do, and just always remember why you got into dentistry. And if it's, for a pure reason, then stick with that and make sure that you honor that every day, because it's such an amazing industry to be in. And I love it so much that I just hope everybody is as satisfied as I am in this career.
Very well said. And to your point, life is so expensive now, and graduating from dental school with that huge amount of debt can be really cumbersome for many graduating dentists, that it can be really difficult to know how you're going to move forward, how you're going to learn to manage all of this debt and potentially, buy a practice, buy a home and manage all of that debt as well too. Thanks for tuning in to this first episode with Dr. Pamela Maragliano. You can find her on Instagram, Dr. Pamela_Maragliano. And don't forget to check her out on her podcast, Dentistry Unmasked. You'll also find her sharing the stage with our friend, Dr. David Rice. Tune in next time for another episode with Dr. Pamela, where we talk about a financial mistake.